Welcome to Mainline Health's Menopause and You Chat with a Physician. I'm Dr. Beverly Vaughn. Today, we are speaking about postmenopausal bleeding. We have the good fortune of having Dr. David Holtz with us today. He is the Chief of GYN Oncology for Mainline Health Systems here with us. Welcome, Dr. Holtz.
It's a pleasure to be here, Dr. Vaughn.
There are women who wonder if bleeding after menopause is normal. Is any bleeding after menopause normal?
It's not normal. It may not be an emergency, it may not be a problem, but it is not normal. And just to be clear for everybody who's listening, when we talk about menopause, menopause is the first 12 months that a woman goes without any bleeding at all. That generally in the United States occurs at age 51 or thereabouts. Prior to this, in the perimenopausal period, you can also have abnormal bleeding. Periods should get farther apart and lighter in the amount of blood flow. If it's getting heavier or closer together, that's abnormal. Either postmenopausal bleeding or abnormal perimenopausal bleeding. It's something that should be addressed with a woman's gynecologist.
What about women on hormone therapy? Is it normal for them to have bleeding?
Maybe. In the first 2 to 3 months of instituting hormone replacement therapy, there can be some spotty bleeding. Also, there are several forms of hormone replacement therapy, the most common being combined continuous hormone replacement therapy, where it's the same level of hormones every day, the whole month. There should be no bleeding with that type of hormone therapy. Some women are on something referred to as cyclical hormone replacement therapy, where the hormone levels change throughout the month, and with that, towards the end of the month, there can be some spotty bleeding.
I imagine that there's several causes of bleeding after menopause. Can you tell us what some of those might be?
Absolutely, and thankfully most of the causes of postmenopausal bleeding are benign and not cancer related. The lining of a woman's uterus can become extra thin, which is referred to as atrophy. That's one of the more common reasons for bleeding. Women's uteruses can develop polyps, which are finger-like overgrowths of the lining of the uterus, which again are benign, not cancer. More unusually, women can have a thickening of the lining of the uterus called a hyperplasia, which can, in some instances, be a precursor to cancer. And then, of course, about 15% of women, or 1 woman in 6, will have endometrial cancer with postmenopausal bleeding.
What kind of testing would be necessary to evaluate a patient for bleeding?
A woman in the postmenopausal period who has any bleeding, again, should bring this up to the attention of their gynecologist. And there's 2 acceptable ways to evaluate postmenopausal bleeding. A biopsy can be done in the office at the time of a visit. This has a tiny bit of discomfort associated with it and may cause some spotty bleeding. Alternatively, if a biopsy can't be obtained or if a woman is not able to get into her gynecologist, an ultrasound can be done of the uterus. Now, it's important that this ultrasound be done with a transvaginal probe, so there is some discomfort associated with that too, but both are equally acceptable for trying to rule out the risk of a malignancy.
What treatments are recommended?
Well, the treatment depends on the reason for the bleeding. So, for instance, if a woman is having bleeding because of thinning of the lining of the uterus, atrophy, we would want to use hormones to thicken the lining of the uterus, and that can be either oral hormone replacement or vaginal hormone replacement therapy. If the woman has endometrial polyps, that's removed in an outpatient minor surgical procedure called a dilation and curetting, or a DNC. Usually that's done with hysteroscopy, where you look in the uterus. The treatment for endometrial hyperplasias is usually, again, hormonal, and that's usually through oral hormone treatment. And then obviously cancers are treated generally with surgery.
Certainly women who have medical problems that have postmenopausal bleeding, they may not be a good surgical candidate. What options of therapy are there for those women?
Well, this does happen because endometrial cancer can occur in women in their 80s and 90s, and as you pointed out, can have many medical conditions associated with their care. Other treatments include hormone therapy, again using very high doses of hormone progesterone to convince the cancer not to grow anymore. Alternatively, radiation therapy can be used also.
Dr. Holtz, thank you for being with us today. It was wonderful information that you provided for our audience.
Well, thank you for inviting me. It was a pleasure to be here.
You're welcome.